Lindsay with Empower Movement Physical Therapy. So I want to talk to you a little bit about arthritis, specifically arthritis in your hands, because this is super common and something that we see in the clinic quite often. So one of the questions that we get from patients is, my parents had arthritis in their hands, my mom's hands are all like nubby and gnarly, like am I going to get arthritis? So there's definitely a genetic component to arthritis, but just because your parents had arthritis does not necessarily mean that you're going to get it. There's tons of different factors that can affect the progression of arthritis. And actually they're starting to find that arthritis can show up even super early, like with people in their 20s, depending on the type of job that they do. However, again, that progression of when it actually becomes symptomatic is highly variable. It can depend on the type of work that you do. It can depend on the quality of your joints and the quality of your tissue, how mobile you are, how good of blood flow you have. So there's so many things that get tied into whether or not you're going to get symptomatic hand arthritis. Oftentimes when we see arthritis of the hands, it's in the joints of the thumb, or we'll see it like in the actual like wrist itself. Kind of a fun little fact about your hand and your wrist. So these lower wrist bones are actually pretty cool. There's a whole bunch of little bones that sit in there, and a lot of them don't have muscle attachments. And so just doing like a regular like stretch of your hand may not actually get to that area. So sometimes those joints need a little bit of help, like some actual like mobilizations of the joints. And that's what we're going to go over in a future video, is how you can mobilize those joints or positions that you can put your hand in to help those joints move a little bit better and glide more smoothly over each other, where traditional stretching just isn't going to do the job. But you know, oftentimes we have a lot of patients who are working on computers, who are using their hands all day long, people who work in hair salons, people who are even like at the gym, you're doing lots of farmers carries and overhead lifting and stuff like that. That stuff is all good for you. It's making your hands stronger. However, everyone's tissue has a different tolerance. So some people can get away with a lot of that for years and years and years, and their hands are totally fine. And there's other people where after their first day at the gym, all of a sudden their hands are super swollen and they're miserable. So again, everyone's tissue is different. There's lots of different factors that can go into whether or not you have hand arthritis. However, there's a lot of stuff that you can do as well to help control symptoms, to help slow down the progress, and to just help make you feel better overall. So stay tuned for a future video.